The vision of the Chronic Disease Prevention Action Team is that Eau Claire County will be a place where all individuals, those with a chronic disease as well as those at risk for or living with a chronic disease, can achieve optimum health and well-being.
The biggest accomplishment thus far for the Chronic Disease Prevention Action Team has been the implementation of the Be Fit Forum, B representing built environment. This forum brought together a stakeholder group including local builders, designers, city planners, health professionals, students, and community stakeholders to look at how the built environment, our streets, our sidewalks, our buildings, impact our health. Our team has several next steps lined up, including pursuing additional grant funding to support our work with our food systems sub-team, as well as our Healthy Communities Design sub-team. We also are looking to strengthen community and clinical linkages through continued efforts with our partners with healthcare systems. In addition, we're looking at exploring a sustainable model to increase support for local worksite wellness programs. And lastly, we're looking to harness the momentum with the Healthy Jobs Act to develop more tools, communications, and supports to increase worksite wellness opportunities for our local businesses.
The goal of the Family Violence Prevention Team is to increase awareness that domestic violence and sexual assault is happening in our community, let community members in all population demographics know about the services that are available for victims, and work to provide prevention and education to youth on intimate partner violence dating. The team is currently working on restructuring and looking to approach the year with re-energized new ideas and tactics to create focused action around this health priority. They are always looking for new faces around the table to help create this action.
Most adults in Eau Claire County do not binge drink, but we all pay the price for those that do.
The state of Wisconsin has relatively high incidence of high-risk drinking, and Eau Claire County is even higher. And it's not just among young people, not just among men, it's throughout the county. Young people, older people, men and women. It's a serious and costly problem.
The High-Risk Drinking Prevention Action Team strives to educate and encourage people to drink responsibly in a way that doesn't stomp on people's rights, but just creates a healthier community for everyone. Already we've gotten 2 grants, one to conduct focus groups with 18 to 25-year-old drinkers to understand their motivation and how to reach them, because we really want this to be, it's not important what I think, it's really important what they think. We also have a grant to look into policies that are effective to reduce high-risk drinking.
The Mental Health Actions Team vision is really mental wellness. It's the way we're changing the way we view, access, and navigate the mental health highway. Our mental health literacy project we wrapped up in early May and finalized it in June and July with our mental health glossary. This tool is used to help bridge the literacy gap by creating a common language describing mental health in the Hmong language. The Mental Health Action Team has also had opportunities to work with the Leadership Eau Claire, the adult and the youth group. So the Mental Health Action Team clearly has had a very active and successful year. As we move forward through 2015, we are looking at solidifying our goals and with other activities to provide a proactive approach to mental wellness. The Mental Health Action Team was asked to partner with the Eau Claire County Medical Reserve Corps to participate in a grant opportunity that will focus on suicide prevention. Together with the Medical Reserve Corps, the team will be able to provide question, persuade, refer, or keep QPR training to the community. Large community trainings will be starting just in time for Mental Health Awareness Month, which is in May. Trainings will continue through June and July.
To reduce the burden of dental disease in our community, we feel by increasing our community's awareness about the importance of good oral health throughout the lifespan, we can accomplish this goal.
So to narrow our focus on our goal, we took a look at some evidence-based research, and across the board, for CDC it works in tandem with the National Health and Nutrition Survey. And across the board, they found that in all age groups, there was an improvement in the oral health of the population. However, there was one segment of the population where we are seeing an increase in dental disease, and that is in the 2 to 5-year-olds. So in order to address this issue, we needed to establish some strategies before these children became, were 2 and 5, and to look at an earlier intervention process. So we then developed our dental home by age 1, and this was also a national initiative through the American Dental Association and through the American Academy of Pediatric Dentists. Their focus is they would like children to be seen by age 1 for their first visit.
We're a vibrant and committed group of citizens who would love to have you join us to help create a healthier community for everyone here in Eau Claire County.